Hey, I'm Dr. Paul and with the Secrets of Chiropractic Success. Again, I've opened 77 offices in 20 states. Let me share with you the the minimum marketing that you would need to know to create more new patients than you physically can handle. Again, I've opened 77 offices in 20 states, so I think it's safe to say we know something about how to get new patients. But essentially, you can go in circles and circles and circles and chase everything with different new patient systems. But if the new patient systems, if I were starting a practice today, what would I do? Number one, I would make sure from the internet, I'd make sure I hire somebody who's really good at Google for Business or what's called Google Local. And that's not just about getting reviews. There's multiple factors involved with that. And there's a lot of technical components involved. So it's better to actually pay somebody who really knows what they're doing that focuses on that. And I always say only deal with somebody who's been in practice 5 years, and that's all they do. Because the more things people do, the less good they are at all of them. That's essentially what happens. But that's the third place that patients look when they're looking for a chiropractor. So I would do that. Number two is you want to do Google pay-per-click but you only want to do it for your industry keyword. The industry keyword is chiropractor location, whatever your location is. That's what people Google. 75% of the patients will Google their location. So, and there's a lot to that also. You would want to use the Google algorithm to find out with that word. And that's the only word. Don't chase any other words. It's just that industry word. And you would want to use the Google algorithm to go, okay, when is the bell curve of most people Googling that term? What day and what time of day? So you may only buy 2 hours or 3 hours a week. So your budget may only be $50 or maybe $100, but you'll be in the best position. And then also you want to use the proper demographics, psychographics, and geographics. Well, if you use the Google algorithm, you'll find that, or you can actually upload your patient base emails and they'll just use the demographics and psychographics and geographics from that. So that works. So that gets you in front of the best people at the best time for the least amount of money. That's what that does. Okay, so that's the passive form of marketing. To really control how much business you need, it's called educational sales. Know how to give an educational sales presentation. Now, this is what we did to open all offices. Remember, there's only 8% of the population that's looking for chiropractors. So the greatest majority of chiropractic patient is not the 8%. Out of the 92%, 3 out of 4 of them have a chiropractic problem, but they're not looking for a chiropractor. So that's why advertising and publicity doesn't work. The only marketing that does is called educational sales. It's a combination of education with sales. And the most important part of that is the sales part. It's not the education. Now, when I say sales, what am I talking about? I'm talking about establishing need and minimizing the obstacles of time or money. That's what I'm talking about. So if you know how to take the education with the ability to do that, and then you do that in front of a high probability target market. In other words, all these people that are having joint pain, neck pain, back pain. You got to remember, there's more people driving by your chiropractic office going to the emergency room. That's the back pain's the second leading cause of going to the emergency room. You got more new patients going to the emergency, driving by your office, going to the emergency room every day than calling your office. It's the second leading cause of going to the general practitioner, back pain. So again, you got more people going to a general practitioner, and general practitioners see more back pain than chiropractors, and 99% of back pain is mechanical. So it should be chiropractors, but it's not. So there's a huge potential. And by the way, this is one of the ways I was able to open 77 offices in 20 states. We weren't just limited to the 8%. Now, when you do Google for Business or Google pay-per-click, that's only targeting the 8% that's looking. So it's going to be limited, and then it's going to be distributed by the number of chiropractors in your area. So those are limiting numbers. But essentially what you're doing is buying patients. That's what you're doing. But the real volume of patients is that 92%, 75 out of 92 that has a problem, but that's not looking for chiropractors. Well, how do you reach them? It's called educational sales. And of course, we teach that. I taught that in 3 chiropractic colleges. That's how you get a lot of business. Now you can do it one-on-one. That's called referrals. So when you know how to, in other words, there's 9 specific steps you got to go through to create a referral. And there's what's called 14 emotional triggers. That's educational sales. So if you don't do those 9 steps, or if you do less of them, or if you don't know the 14, you don't do them, then that's what significantly decreases the likelihood of your effectiveness. But when you do apply those, and then you apply it to a target market, in other words, people who already are having back pain, neck pain, headaches, joint pain. Remember, 1 out of 5 people in the United States has arthritis, and the number 1 cause is osteoarthritis. So there's a ton of people with back pain, neck pain, headaches, joint pain. They're everywhere. They're just not looking for chiropractors. So if you don't know how to access that market, well, that's the only marketing that gets that business. And that's why it's called educational sales. Then you want to apply that individually to your patients and go to their circle of influence, or apply it to in a group setting. Like if you want a lot of patients fast, you apply it to a group setting. That's how we started every practice from scratch. We would do 2 educational sales presentations, get 10, 20 new patients. Then we also knew how to keep them. And that was it. We were off to the races. We did that for 2, 3 weeks. Practice within 90 days, the practice went over 100 visits. And we're off to the races. That was it. Because we knew how to get all those patients out there who were not looking for a chiropractor, but have a chiropractic problem. And that's the only marketing that does. And it's right out of what's called the S-curve of economics. And I used to teach that again. I used to teach that in 3 chiropractic colleges. So, and then here's the 4th. So it's Google local, Google pay-per-click, knowing educational sales one-on-one to create referrals and not just wait for them, know how to do it in a group setting to get a lot of new patients fast. And then if you really want to increase your dollar per visit, personal injury attorney educational sales, because 87% of the accidents have a soft tissue injury, 87%. And only 32% are going to chiropractors. So there's a huge difference, some 50+% of people have soft tissue injury and addicts that don't even go to chiropractors. And by the way, they don't go to chiropractors for the same reason the 92% doesn't go, because they're confused. Chiropractors say they can do everything. And when you say you can do everything, the rule in marketing is you can do nothing. That's the number 1 way to destroy credibility, is to say you can do everything. And that's why chiropractic's at 8%. So the only thing that overcomes that is educational sales. So we do the same with the attorneys. Attorneys aren't looking to refer to chiropractors. Matter of fact, if they have worked with them, they probably have seen that they have really bad notes, and they usually have to ask for a reduction in their fee. That's the number 1 reason you're getting asked to have your fee reduced, is the notes are so bad, they give a really bad injury award. That's the number 1 reason. So when you learn personal injury, especially personal injury education sales, you take that 50+% market, that soft tissue injury market that's not going to chiropractors, and now you have access to all those patients. So now you have a lot of you get patients that are looking in Google for local, Google pay-per-click, then you know how to create patients through the educational sales. And if you want a lot of patients fast, do the educational sales presentation to groups. That's when you get 5, 10, 15, 20 new patients at a time. Now, then if you want a higher dollar per visit, you want $100, $150 per visit, then no personal injury attorney educational sales. And that's what creates way more business than you physically can handle. I left out one part. If you're not good at patient retention, you're in trouble. Everything with chiropractic starts with patient retention, and actually everything. And I found most chiropractors are losing 33% of their new patients by the 8th visit. 33%. They're losing a lot of new, and a lot of times they don't even know it because they don't keep stats. They just always think they need new patients. And it's usually from their lack of knowledge or skill in knowing how to communicate and keep patients. I just did a stat the other day. Chiropractor has a patient retention of 12. 12. That doesn't even take somebody past the second phase of healing. They've already stopped care, and the patient's not even got finished the second phase of healing of the 3 phases of healing. So that person's going to end up with a permanent problem to some degree, just because the doctor doesn't know how to communicate it. So anyway, those are the 4 systems. So, if I was starting a practice, that's exactly what I would do. That's how you'll create more business you physically can handle. So it's patient retention, number 1. Google local, pay-per-click, only for the industry keyword for a limited time. That's it. Educational sales, to know how to create referrals from your patients, and then educational sales in groups. That's what gets a lot of patients at one time. So you got educational sales, Google local, pay-per-click, one-on-one educational sales, group sales, and personal injury attorney. That's all you need to know. That's what, six systems. But they all take knowledge and skill, unless the 2 you're going to pay for. So you're going to pay somebody else that has the knowledge and skill in Google for Business or Google pay-per-click. And if you're interested, I actually sell the attorneys for you. So if you're interested in creating personal injury attorney referrals, I would just teach you the documentation. Then I do actually the educational sales to the attorneys in your area to create referrals for you. I do that once a month. So that's it. Those are the only 6 systems you have to know. Those are the basic cost. It does take knowledge and skill. It does take effort, but that's when you can create more business than you physically can handle. And that's when you'll need to learn how to hire, train, and manage associate doctors. That's how, when I learned all that, that's how I went to my first associate doctor, my second associate doctor, my second office, my third office, my 4th, 20th, 30th, 40th, 50th, 77th office. That's exactly how we opened 77 offices in 20 states. Give me a call if I can help you. Again, I'm Dr. Paul Secrets at chiropracticsuccess.com. You can check us out there, or 954-740-2722. Give me a call if I can help you.